It's really spring has started here. It's beautiful, but we're still social distancing, which gets harder every day when it gets sunnier. But we're managing. I'm also here today with my colleague Dace, who's signing in from her home in Utrecht.
Hi, everyone.
Yeah. Well, we have a great panel here today as well. But before we introduce them, maybe introduce the webinar, the topic a little bit. For those of you who logged in 2 weeks ago, we had a few CEOs talking a little bit more about how the coronavirus was affecting their regions, affecting their businesses, and then also talking a bit more on the what they're doing now to maybe already reshuffle, reinvent their business, how they're dealing with the corona crisis. Today we'll have a bit more hands-on projects information that we'll share with you. But before we go into the introductions of the panelists, we also have a question for you, Dace.
Yeah, so as Anne-Maj said last time, we talked a bit more on high level, trying to illustrate where are we now and how are we dealing with the current situation. But we also hear more and more that we should be doing something, as we are privileged to work from home and to be able to continue our daily business as much as possible. So we do, or we should also see how we can help. So, and we know that there are various initiatives starting in the industry. There are many companies starting, seeing how they can help. So we thought we would like to know what you are participating, what initiatives you are participating in. So we would like to hear from you. So if you don't mind, please write it in a chat. We will have a look at it throughout the webinar, and then we'll also address it and review it at the second part of the webinar. We are very curious. Please let us know. And with that, we can introduce our panelists, right? Anne-Maj?
Yes, absolutely. And you actually will see all of us also here on the screen. We are sharing our videos. We put on some nice clothes, some makeup. We did our hair to make it a bit more enjoyable for all of you. Thank you, first of all, Alex, JP, and Will for joining us today. I know that it's very early for some of you and very late for one of you as well. So thank you for accommodating this time for us. Maybe JP, do you want to give a quick introduction? Let's keep it very short for now.
Yes. Hi, I'm joining from San Diego, California. It might be sunny outside, but I'm not going outside. I am representing SYSTRAN. I am the CEO of SYSTRAN. And I will admit that I did shave since we were going to be on video. So that's my contribution.
Great. Thanks. Alex.
Hi, everybody. This is Alex from China. I'm actually now in Chongqing, in the hometown of my wife, Catherine. Now, Catherine is sitting beside me watching movies, and our parents are sleeping. It's 11 o'clock right now, near midnight. I'm working at the Beijing Language and Culture University. I normally teach translation technology, localization, and project management. That is what I'm teaching right now, and now I'm teaching online. Now everybody is teaching online.
Yeah, thank you. And Will Lewis.
I'm Will Lewis. I'm with Microsoft Translator. I'm in the Seattle area, and it's a beautiful day outside. And again, I don't think I'm going to see much of that weather today, which is unfortunate. So we work on the Microsoft Translator API and products, and I can go into more detail later, of course. Thank you.
Thank you. So we have 3 different cities, different regions. How is the corona crisis over in San Diego, in California at the moment for you, JP?
So far, it's California's lockdown seems to be having a good event at a good result in bending the curve, as they say. So San Diego itself, we've got a little over 1,500 cases, but it does seem like it's not as sharp of an up curve as other regions. So hopefully that keeps up, that people actually respect the social distancing requests. And you know, I know that for all our team, you know, we've transitioned for a few weeks now, and you know, just you know, everyone's getting used to the new reality.
Yeah, yeah. And Will, what about you in Seattle, the first region to hit very hard in the U.S.?
Right. Yeah, Seattle was hit first. We had the first case in the U.S. As well. And I think our governing bodies took it seriously, and we shut down pretty early. Microsoft shut down even before. So I've been working from home for almost a month at this point, and it's not going to let up for at least another month. And I think that's showing an effect. The number of cases are starting to plateau, I believe, and the death rate is starting to plateau as well, which is a good sign. I like to say that we see a glimmer of light at the end of the tunnel. Unfortunately, I do know two people who have or actually three people who have had the coronavirus, two of whom have recovered. One of them lost his sense of taste and smell, which is an odd effect from the coronavirus that's been reported in certain cases. And then another person, an acquaintance of mine, actually died, unfortunately.
Yeah. Terrible. And Alex, in China, how are you doing with it?
Okay, so now I can say that I'm safe, and my family members are all very safe, and our friends are all very safe. I don't know anybody that I know that are dead from this viruses. We know that people in Wuhan and in some other cities died from this. It's a tragedy, but luckily we are safe from it. Later on, I'm going to show my location and see where I'm right now. And luckily, every day we watch news with our parents, and we see that not so many new cases coming from China. We are worrying about the imported cases coming from other countries, from overseas. But still, the safety measures are being taken very carefully, and we still have to wear masks when we go outside. Even though we don't know anybody here that are infected, but we still wear masks, and we wash our hands often to make sure that we keep the virus away from us.
Yeah, in a way you speak, for us, you speak from future, as China is 1-2 months ahead in the virus management, right? So I'm sure you have you have seen through it while we are still experiencing it. And that is why it's also nice to have you here. As you know, to have the perspective of you know, a different situation. So let's go with the topic today. So here's a overview of the agenda for the webinar today. So we'll start with Alex. He will talk more about his experience as a teacher at the university, but also from his contacts with the Chinese MSPs. So how did they experience this crisis, and what effect has it had on their business? Oh, we did change the agenda order in the last minute, but we did not change the slide here. So then we will continue with Will, who will talk about what Microsoft is doing right now, and also explain more in detail the initiative that has been started by various organizations to help get COVID-related content translated in as many languages as possible. And we will also talk about the TAUS initiative, so the Corona Crisis Corpus collection, where we will talk how far we have been and how SYSTRAN is helping us to really ensure that it does deliver some benefit to the wider community. So with that, let's jump to Asia. See, whoops. How is it going there?
Can you see my desktop now?
Yes.
Okay. So probably I'll spend like 15 to 20 minutes to go through these slides and give you some numbers and facts about what I know right now. So hi everybody, good evening and good morning. And so first of all, I'd like to let you know about my location. So normally I worked in Beijing. I left Beijing on January the 18th. That was the end of my semester. So I left Beijing, and we together with my wife we went back home to Chongqing. It's kind of like in the middle in China, and it's famous for hot pot, for some spicy foods, and it's very close to Hubei province. You can see here. Actually, we're near to each other, but we are the place where I lived is a little bit far away from the capital city of Hubei, from Wuhan. So it's about 900 kilometers away from Chongqing to Wuhan, and it will take 12 hours to go there by car and 6 hours by train. And from Hubei to Beijing, I'd like you to know the distance between Beijing and Wuhan is about 1,200 kilometers away. It will take 14 hours to drive by car and 6.5 hours to go there by train. But I've never been to Wuhan. I like to visit there, and I have very many good friends over there, and I plan to go there to attend one of my friends' wedding ceremony. But you know, now we cannot go there, at least for the rest of the year. And for the data, you can see that, so this is from a website called the DX Doctor, Dingxiang Yisheng. So it's how we get all the data from all the provinces. You can see there was a map. We can see that in different provinces, we can see the exact data. And in Hubei, this is the data from today.
Alex,
now
sorry, Alex, could you switch on the present mode so that we can see the slide better?
Okay. So you cannot see my slides right now?
No, we can, but yeah, in a full screen mode, if possible.
In full screen mode? Okay. Let me switch back. Probably the Microsoft Translator will start. To cancel.
Oh, it is, yeah.
Yes, I'm using it all the time. I'm showing people how to use Microsoft Translator in PowerPoint, actually.
Oh, thank you.
We did a demo in TAUS Asia conference 3 years ago about how to use the Microsoft Translator. Okay, so this is the full mode, right? So you can see that this is the data that we have for today. Now, totally, there are 67,000 cases of confirmed infections in Hubei province, and there are 50,000 in Wuhan. So you can see that Wuhan is the epicenter of the outbreak. And now the data we know right now, we receive right now, is there are 3,215 people that died from this virus. We know that there are some news around saying that this is a fake data and China is covering up everything, but actually this is what we know, and the government is explaining to us why the data is like this, not like the I think it's 40,000. That is what the Western media is telling about. And now we know that 64,000 people, patients, are cured, and among them there are 47,000 in Wuhan, and we still have 401 confirmed cases remaining there in Hubei province, and among them there are almost everyone is in Wuhan, and we don't have any new suspected cases now. That is really good news, because you see there's another data. Wuhan just finished the lockdown last day, April the 8th, and you can see for the whole day over 52,000 people left Wuhan for a day, and 31,000 people entered Wuhan. And they have a data coming from Xinhuanet, from government media, saying that 624,000 passengers use the public transportations in the city of Wuhan. It means that people are actually moving. They're moving out of Wuhan and also moving into Wuhan. And we know that the reason why Wuhan is recovering right now is because over 40,000 medical staffs from over 32 provinces, they went to Wuhan to provide support. And if you go to see the news of what was happening in Wuhan, you will see that there are a lot of very moving, very touching scenes of the doctors and nurses. They help those patients, even though still a lot of people die from this, but we are seeing good news every day. So starting from April the 8th, from last day, the lifting of the lockdown has green lighted the reassumption of inbound and outbound travel. So people can go to Wuhan or leave Wuhan by car, by air, or by bus. So, but still, some people are worrying about if Wuhan is really kind of like free, but actually people are actually not really returning back to their normal life yet in Wuhan. There are still very strict restrictions. People can still not go to watch movies or watch football games. That's not going to happen, at least for now. And the government haven't eased the restrictions. They still have to use some QR codes to go to anywhere they want to go. I had some news from my parents in Dongying. It's in Shandong province. It's very near to the eastern coast of China. They called me and tell me that 5 people driving from Wuhan to our hometown, and one of them were tested positive for that. But that was many days ago. That guy was infected, but still now he's healthy right now. But still, people are worrying about that. We're worried about people from Wuhan that probably are carrying some virus, especially for people that we call it asymptomatic patients. They don't have any symptoms, but they carry the virus. People are worrying about that. Okay, so this is the general situation of what I know about China. So generally speaking, actually, we are safe. And now there is some key takeaways that I can talk about for what's the life is now right now in China. So for the outbreak, so I can say that the outbreak is not over. It's not over, but we believe that it's under control by the government. And there are still a lot of uncertainties. As I said, we worry about the people who are carrying the virus, even though there are no new reported cases, but still we worry about that. And the central government and local government, in China we have a central government and we have a lot of local governments, and under local governments we still have some governments officials running the whole country. So they're continuing maintaining strict restrictions, but not very strict, like where I'm living right now. When I go outside, if I don't wear masks, no people will come to tell me that you have to wear your mask. You don't have to do that because a lot of people are actually not wearing masks, and no one is telling us you have to wear that. But for those big cities like in Beijing, like in Shanghai, Shenzhen, like those big cities, also in Chongqing, the downtown of Chongqing, I'm not actually far away from downtown. In downtown of Chongqing, people are still managed under very strict restrictions. And sister measures are actually being taken to protect the people. We have very enough supplies like masks, like sanitizer, all those things. So supplies are enough. We don't have to hoard all those things in our home. And even for food, some people are telling our parents that you have to buy some rice. And in one day, people start not to buy any more rice because we know that the rice is still very cheap and we still have enough rice. So generally speaking, price of everything is stable. We don't have to worry about we cannot buy anything from the web, from the internet, or from the local stores. We don't have to worry about that. And the worries, like I said, we worry about the people that still carry the virus, and we worry about the resumption. I have some friends who lost their job in Beijing. Some internet companies, they just said that their boss said they cannot provide enough payment for them, so they have to leave from their job. And for some people who are running some restaurants and some factories and some training schools, those people cannot open their factory or company. So that is what we worry about. We worry about that people will lose their job because of they cannot recover back to their normal status. And the government is trying very hard to prevent imported cases from overseas. That is what we know. And they want to promote resumption of work and production. And we know that for a lot of companies, they're recovering like 80% and 90%, but still there are some other SMEs, small enterprises. It's very hard for them. But we will give you some good news from the language service industry later on. And another worry about the people who are suffering from this outbreak, from this virus. We know that people are losing their family members, their relatives, and we hope that we can do something to help them rebuild their life. And there are a lot of volunteers around trying to find who needs help and what we can do for them. And another thing that we worry about is discrimination and prejudice. I have some friends coming from Spain and also from America. They said even the children over there are calling them virus. So we really worry about that. And for students, like my students, they are going to Scotland to not Scotland, Ireland to study for localization, but they worry about that if they go there, people will call them virus, and they worry about their own safety. So that is something that we worry about. And this is a general situation of what's going on in China. If you have any questions, you can leave to me and I can answer. And then my next part is about what I'm doing, because my job is teacher, so I teach online. And you can see the numbers here I gave to you. There are 518,000 schools and 16 million teachers and nearly 300 million students now in China. And during the break, we can use DingTalk as an example. Over 50 million students are using DingTalk to learn online. I'm actually using DingTalk because I'm going to show you. This is the interface of DingTalk. It's very useful. I can use it to have online conference videos with my students, even though they are from different provinces, and we can manage our teaching materials online, and we can save the chat histories, and I even know how many people are reading, have read my messages, like the one you can see that only one people didn't read my message because that one is offline. And I can easily organize these people. So I was responsible for helping my university to set up an online teaching platform. We use 1 week to help 2,000 students and teachers to join DingTalk, the organization, and start to train them for like 2 days, and then we start to teach online by using DingTalk. We have a lot of support from DingTalk. And not only DingTalk is being used by universities and schools and other schools, we also use like QQ, WeChat, Tencent Classroom from Tencent. Tencent have a variety of products that can provide teaching features. And we also have Zoom and other platforms. So in China, we've been working on teaching online for many years, especially after United States started the MOOC platform, the massive open online courses. China started thousands of online courses, and all these courses are being provided to students for free online. So we can actually get all the courses online for free. So we don't have any problems teaching online or learning online, but there are some students who are living in the rural areas. but local governments is giving them some free phones and helping them to set up some 4G network to help them learn online. So the local governments is actually giving a lot of support for the poor students. The Ding Talk. And my next part is about the language industry in China. So if you want to know more about what's going on here in China, there was two sources you can follow. The first one is a report from my colleague from Beijing Language and Culture University. My colleague, Professor Wang, he and his team published a report on the survey of how the coronavirus is affecting the language industry, and they translated it into English and published it later. And also Renato have a lot of friends in China, and he did some survey and talked to some of the friends in China, and then he published a very short article in LinkedIn about China's LSPs, a voice from the future. So generally speaking, what's going on here in the China's language service industry? I'm sorry, this is automatic. So generally speaking, the first one is a lot of companies, language service companies, they have stable business. So they are not actually losing their business like the restaurants, like the training schools, because they're always working online. And even though their employees cannot go back to the company, they can still working online and talk to their clients. The problem is their clients are cutting business with them. I'm sorry. So it means that some people, they are worrying about losing contracts, especially in the United States and in Australia and in some other countries. They have, especially for the IT companies, some IT companies are still providing business for these companies, but still for the local industries from other, like the insurance company, like the bank, they are not giving enough contracts to the language service industry. But for our university, we're also doing business with some companies, and we are, our teachers and colleagues there, we have a lot of contracts from some governments, and the government is also giving some contracts to the language service in the industry. So my friend told me, I asked several friends who are working in who are CEOs of the language service industries, and they said they still have a lot of translation to do. For example, for some companies, they want to sell products to overseas, and they need to translate their documents into other languages, sometimes in multiple languages, and they need people to help them translate. And machine translation was not helping in the very beginning because the quality is not good, the data is not enough. So they have to rely on people. And also, we have some companies, they have stopped recruiting new employments. So that's the problem of our university, because we're sending people to the industry. And 2 days ago, I received data from my colleagues. This year, we have 80 students graduating. They're all majoring in translation and interpreting, and only 10 of them have already have an agreement with the company. So it means that nearly 70 students are still looking for jobs in the industries. So this is what I worry about. And you can take a look at the data from Slater and from Renato Beniato. So you can see that another very good news is the government is actually funding the SMEs, the small companies, to support them and to reduce their taxes. So that is a good news. It means that the government is actually helping. Okay, this is a very short introduction of the language service industry. And for the university, I have 2 examples to show you. The first one is also from our university. We started a guide to the prevention and control of COVID-19 epidemic in foreign languages, and now over 30 language versions of this guide is available are available online. So mainly this is for helping the foreigners in China to let them know how to prevent the coronavirus. So we translated a lot of very short guidelines into other languages and recorded them into audios and videos and then we send these materials to the airports and to the governments, and they're spreading it and show them to the volunteers and to the people coming into China and to the people who are staying in China to help them know what's going on. And for my students, a lot of them are going to the communities, but they're not actually entering the community. They're waiting in front of their phone they have some calls from the police, from the nurses, from doctors to help them translate. And a lot of volunteers actually they're also fighting in the front line. They're fighting in the airports. We have a lot of students, volunteers, translators, interpreters. They are working in airport together with the police and the doctors. So we have a report from Xinhua that is in English. I can show you if you like. To the reporter from Xinhua Net, they also asked me for what we are doing. From this report, I know that not only we are working on the translation and interpreting work for the outbreak, there are a lot of students from other universities. They're also working together with the governments.
Alex,
so this initiative, okay.
Sorry for interrupting you. I'm just keeping an eye on the time, and you have so much information, and it's very interesting. But we do have a lot more ground to cover. So maybe you can summarize the other things you still wanted to say today, and we can find maybe another way to put all your information out there for the people.
Thanks. This is the last slide. So when we are translating all these documents, we noticed that there is not a central bank for all the bilingual database. So I started this a month ago. We call it Buy COVID, like a Bye COVID. So it's a Buy COVID. So I started this and I coded all the pages, and then I called around 90 volunteers to help me align this data by using ABBY Aligner and also TMX Mall, as a Chinese company. So now we have over 3 million words in 6 language pairs, and we are providing this to the volunteers and for the translators and the companies and the governments for free, and they can also download all this data. And I'm also contributing this data to the TAUS crisis data to make sure that some of the high quality bilingual translations between Chinese to English and English to Chinese can be used to train machine translation. We don't train it, but we hope that the people who need this data can use them to train their machine translation engines. So generally speaking, we are actually trying very hard to protect ourselves and also provide the data and language services to the community, to the society. That is what we're doing right now, and that's the end of this presentation. Thank you very much for your time.
Great, thank you, Alex. It's great to get an update from China, and indeed, as Dace was saying, it's for us almost a look into the future. Thanks for that, and maybe that's a nice bridge to you, Will, because you have, of course, a couple of things to share today, and maybe we can start with the MT Crisis Cookbook at Microsoft.
Yeah, so actually there are 3 things. Let me just I'll be brief, I promise. I do want to mention that Microsoft has an established philanthropies and humanitarian response team that gets called into action during any crisis situation around the world. And of course, they were called to action very early in this process. Most of that is not language related work. It's usually boots on the ground to help in areas where the crisis is occurring. In this case, we bring to bear a lot of resources for improving communication, for providing aid and this kind of thing. So I'm not directly involved in that team, but I do want to mention this is something that Microsoft does every time there's a crisis in the world. The Microsoft Translator team has worked in crisis situations for over a decade at this point. We first entered the fray during the Haitian crisis, the earthquake 10 years ago, if you recall that. And we developed an MT engine in response to that crisis, because we were working with some of the crowdsourcing teams that were translating text messages that were coming by the thousands out of Haiti. I can't go into all the specifics there. It would take a lot more than half an hour to talk about that, and I don't want to even take that. So, but what we were able to do is produce an MT engine from concept to delivery within less than 5 days, which I think is still a record. But when we saw that, we're like, can we do this again? Is it possible to produce an MT engine in response to a humanitarian crisis as rapidly? And how would we do that? We got lucky with Haitian Creole. How would we do it with other languages? So the model we came up with, and this was developed with research faculty from Carnegie Mellon University and Stanford universities. We developed this model called the Crisis MT Cookbook. So basically the idea is, rather than being reactive, rather than saying there's a crisis in place now, we need to respond to that crisis, let's plan for the crisis in advance. Let's take the content that we see as being necessary for crises, so whether that be a flood, a hurricane, a pandemic, and we translate all of that content in advance into the majority languages of the planet, and have that content, the crisis related content, being readily available, so when a crisis hits, we can pull it off the shelf. Now, if it happens to be a language that we don't support, or that whoever's involved doesn't support, because we've translated it into, let's say, the 20 majority languages of the planet, all we have to do then is to pull that off, pull the language that's the best pivot. So for certain languages, that might be Chinese. For certain languages, it'd be English. For certain languages, it would be Spanish. We pull that particular cookbook off in that language, and then translate as rapidly as we can into the other languages, and then spin up an MT engine. That's the model, and I think we're coming to that, if you think about it. So the next thing that I want to mention is this initiative that there are multiple partners. So it's a multi-partner initiative, business and academic participants. And this is in response to COVID-19. TAUS is involved, Translators Without Borders is involved, Carnegie Mellon University is involved, we're involved. And this was initiated by Paco Guzman with Facebook. So he's one of the partners as well. And the idea is to get as much content translated into not just the majority languages, but into under-resourced languages that are at the edge of this infection. So where the infection is going to hit next, languages where we have no support at all or very limited support. We want to get ahead of this as best we can, provide information on logistics, on the disease itself, social distancing, all the medical terminology that needs to be used in these languages in Africa, in India, where the crisis is going to hit soon. It's already starting, and where it's going to be really bad, and we need to get ahead of it as much as we can. So that initiative, I think, kind of fits that model if you think about it, because if we're translating all of this content, which TAUS is doing, for instance, you have all these materials that have been translated into several languages. If we can broaden that set of languages, then we can respond much more quickly, not just in this crisis, but in other crises down the road. And I mean, COVID-19, the corona crisis has brought it to the fore, but if you think about it, we've had near misses in the past, right? And I think those were wake-up calls too. We had Zika, which everyone was scared of. We had Ebola. We had MERS. We even had SARS in 2003. And in each of those cases, we dodged the bullet. This time we didn't. And I think having materials available in multiple languages, I think, makes the response much more uniform around the world, and then and to the benefit of human life. I think by providing the information that needs to be provided, people will be saved.
Yeah, that's for sure true. Thanks, Will. I mean, we had similar thoughts when we were having one of the TAUS team meetings, when we said, well, we are safe at our homes, but in a way you feel helpless because you can't fix it, you can't solve it, so you still want to see how you can help to change the situation for the better. And we had similar motivations when we started this Corona Crisis Corpus initiative, with which we are also participating in this wider industry initiative that you just mentioned now. So we introduced it in the last webinar, so here's a quick overview again for those of you who are interested in using this data or to contribute with additional data sets. So the goal is to collect multilingual data in the medical domain with the purpose of building and training customized MT engines that could be used by anyone who needs to translate COVID-related content. So it is not, so in difference to the initiative that Will described, it is not to produce translations. So we are not, hiring translators to translate the content from scratch. Our focus is really on seeing what content is out there already translated and that can be used to train MT engines. And we need everybody's help to make this initiative a success. So we have reached out to our community to see if they have any data that they could contribute. We started this by looking at our own data repositories, so Data Cloud and Paracrawl, which is an EU project that TAUS participates in. And we have made a starter kit available, as we call it. It is available right now in 5 language pairs, and more will be coming up soon. We'll be also publishing English, Japanese corpus, and hoping that it will grow in the coming weeks. And of course, so it is an industry-wide initiative, and we could not do that without help. And we have already had contributors. So Alex has already contributed the data that he has been collecting through his own initiative. We have also had other contributors. Thank you to all of them. We have also got some help for data optimization and cleaning, as that is very important, of course, when it comes to ensuring that data is good enough for MT. And with that, we have Intento on model front jumping in and helping us, ensuring the data is clean and ready for MT. And we have SYSTRAN, who has volunteered to train their MT models and make it available. JP, could you tell us more about it? JP, are you there?
Yeah, I was muted just so I wouldn't make noise during everyone else's talk. So so yeah, absolutely. It's very much going along with what Alex and Will already talked about. It's definitely something that we're very interested in helping. So definitely we've taken the data that's been already made available, and we'll take the additional data that's being made available on a continuous basis. So the initial drop was 4 languages. What we do then is we ingest that data, and our team runs our own data ingestion and cleanup tools on it. And then we mix it with our own existing repositories of data, as well as then choose an existing SYSTRAN model to start training from. So we do incremental model training for these. We've already trained the initial 4 languages dropped, so 8 models in all, so bidirectional, and those will be posted very soon. And with the I'm happy to say that the baseline testing, of course we have those models now going through human evaluation before we post them for everyone to use. We do that as a last check before we post anything. But the baseline improvements, just using the Corona Crisis Corpora, are anywhere from 12.5% to 30% over baseline for these languages. So we're going to make all of these available, as Dace said, for free use on our SYSTRAN Translate site, and we'll be posting the information and having the TAUS team share that information as soon as these are posted.
Thanks, JP. That's great. So we will for sure keep everyone updated on this initiative. So whenever there are new tools available as a result of this data collection, we will for sure let everyone know.
Yeah, you know, one thing I would like to mention too, Dace, is for the community at large to think about as well, is that, you know, terminology helps as well. So, you know, that's what's really changing often. And so, you know, people may think, well, I don't have, you know, aligned sentences to provide. But if you got the terminology, the equivalent terminology in new languages, that really helps for the MT trainers, for the translators to understand, you know, how our terms being used. You know, there's a lot of new terms being created on this crisis. And so just terminology, monolingual information, monolingual data, if they could provide that to the TAUS team, that will also help as well.
Yes. So keep them coming, keep them coming. Anne-Maj, are there any questions to any of the panelists?
Well, let's see. There are a few comments here. There's one person, but in the meantime, he has left the webinar, but who said he built or he was part of a group that built a volunteer group on linguria.com collecting COVID-19 related documents in multiple languages. So there's another project happening in the industry. And then there's just a few more comments. So no real actual questions we can discuss. If you do have questions, make sure you type them in the chat box, or other projects that you're working on, type them in here. We do have indeed some time, but maybe that's while people are typing, hopefully, maybe. If you could also go on to the next slide. Yeah, because you might have seen that if you are a very big TAUS fan, you keep an eye on our blog all the time, of course. Yesterday afternoon, we published a new blog. The think tank is really running very fast. So there is life after this, obviously. And as Alex was saying, it might not be normal life. It might not be normal life right away. Well, at TAUS, we've been thinking about the different scenarios. What will the summer of 2021 look like? We've come up with 4 different scenarios. They're all described in the blog, and the link here on the slide, and we'll share that with all of you. And we have now also added a survey to that blog to hear your thoughts. What are your predictions? Is it one of these scenarios? Do you think it's completely different? We'd love to hear your thoughts on that as well, and then we'll publish a report. We might do a webinar or other virtual events around this topic as well. So just wanted to share that while we wait for some questions. And I see one question here already. Thanks. Is can we have another session in a couple of weeks? For sure. I think we are not done discussing this topic. There are so many developments in all parts of the world, so we will keep on discussing what we can do for our industry, for the world in general. So you can for sure count on another session in a couple of weeks.
I have a question to Alex. How was it for you to switch to teaching remotely? You know, one thing is to work remotely as an office worker. You switch on your email, all your tools, but how is it when you need to connect to your students and explain them, you know, the material?
Okay, I happen to write a document to submit to a university to tell about my experience of teaching for 6 weeks. So there's good parts and there's bad parts. The good part is we've been preparing this for a long time. So for me, I know almost everything about teaching online, how to record videos and how to interact with students by using a variety of tools. And in China, there are a huge market on online teaching. So we have quite a lot of options to select from those online teaching platforms. But the bad part is we don't really have the interactions we have in the previous time. We cannot see our students in the very beginning due to the bad internet connections in the very beginning, so we have to switch off the camera. We can only talk to students and type and students. We don't know what students are actually doing in the other side of the computer. And sometimes we worry that students are not actually involving in the teaching platform, in the teaching process. And many other teachers have the same problem with that. But the university teaching is not the most important part right now. The general people concerned about it. They're concerning about the middle school, the primary school, is that students cannot actually focus on learning with their mobile phone for 10 minutes. For some students, they need to, they have to switch back to some other activities. So it's very hard for those students to concentrate. And we postpone our the biggest examinations of China. We call it entrance examination for college and universities. We postpone that for 1 month, and almost every examinations are being postponed, and we don't know when we'll go back to universities. So I really miss the time that I can teach in the classroom and meet our students face to face and discuss things with them. I really miss that time. So I think I can only keep for another 2 months. Otherwise, I don't know what, you know, it's really weird or bizarre to talk to the camera and the screen for 20 hours a week. It's really a weird feeling.
Yeah, for sure. I see now in the comments where people were talking about what initiatives they are participating in. There's also someone saying that she has been taking post-editing courses when the work was a bit down. So I guess it's a translator who is dependent on the project stream from their customers. So I have seen that several translators experience downtimes right now, but it's also good to see that people do take this time to, take a course, learn a new skill, even though it might be difficult to focus and to really, have the mind be able to accept new information on top of everything else that's happening in the world. But for sure, there's a lot of resources available right now, and if possible, we should take this time and come out of it smarter, wiser, better. Anne-Maj, what do you think?
Absolutely, yes. Well, of course, my job at TAUS is organizing events. Well, that changed quite a bit.
Online events now.
Yeah. Well, I'll be honest here. That the first 2 weeks, I was really a little bit like, but what do I do now? I felt a little bit lost, and then I'm also at home by myself, so you cannot really brainstorm with other or get inspired by things. So I'm very lucky to be working with my father, so I can actually see him without really breaking the social distancing rules. We've had lots of brainstorming sessions, and we are. I'm very excited now. We have a very nice plan together for a lot of the virtualization of the TAUS event. So it's an exciting time, but it's also a bit of a confusing time, I think. So you have to find the opportunities and indeed do some education, or maybe, how do you say it, where you reschooling, is that the right word?
Rescoping?
Yeah.
Yeah.
Reskilling?
Yeah, just indeed increase your skills, change your skill sets. Yeah, so I think.
And also, yeah, if there's anything, so if people in the audience, if you have ideas what kind of online events you would like to see, related to our industry, perhaps that is something we can take into account. So please write your ideas if you have any. I know there are many webinars right now, as everybody's working from home, and it seems to be a good time to have a webinar, as there will be audience. But if you find something missing or a particular team from TAUS offering that you would like to learn more, please let us know, and we can for sure address that, as we also have a lot of time now, now that events have been postponed.
There is also a question now, and we have SYSTRAN and Microsoft here, so that's perfect. Now that we have still a few minutes left. The question is, do we know if SYSTRAN and Microsoft translation services also help doctors, not just the general public? And do we have any feedback on uptake or usage scenarios of specialized MT engines or terminology bases by medical professionals? So I don't know, Will, yeah, please go ahead.
Yeah, so we are being used in the medical field. I mean, I had queries, especially in the COVID crisis. We've had queries and people asking about the use of the service. Medical translations, you have to be careful. If a translation is wrong, that could be disastrous. And so we always take a certain amount of trepidation when you're talking about the use of machine translation in a critical life situation. You have to be careful that the translations are accurate. We do support customization. And so being able to customize to particular terminology, so to the terminologies of a particular discipline is something that I think is necessary for just about any discipline, and we support that across our client base. Medical translations are also subject to, or medical technologies are subject to HIPAA requirements and these kinds of things. So there's great care that needs to be taken also on the preservation of privacy. And that's something that we take very seriously as well. So most of our tools are HIPAA compliant.
Yeah, I concur with Will's comments about you need to be careful, and we always advise being to our customers to be careful within a medical translation environment. But we do have various customers that use it in medical environments. So we have hospital systems, doctors, things of that nature that are using SYSTRAN customized machine translation solutions. But I think we specialize in that customizable machine translation for those scenarios. And in terms of this current crisis and the uptick, hopefully we will see some uptick in usage of the custom Corona crisis corporate models for the specific terminology, because it is necessary to have the right terminology in the machine translation, and hopefully that does help systems. As Will was mentioning earlier, the real need is in those longer tail languages where the crisis is going to hit and where we have less information. And so there is definitely where if the community can help and create the terminology ahead of time, or at least trying to get it in advance of that, that will definitely help any customized machine translation solution do a better job for those communities that are at risk.
Very true.
Mm-hmm. I have a small questions for JP and Will. Are you seeing an increasing usage of machine translation or drop down of the usages of machine translation recently?
That's a good question. We've seen a big increase in the use of our telecommunication technologies and stuff and such like that. And within those, so like embedded inside of Teams, there's captioning, and we've seen a huge increase in the captioning use. I mean, because everyone's working from home, turning on captioning means you can see the captioning. So I think one of the things that's happened during this crisis is everyone's working from home and they're relying more on these language technologies than they ever did before. I don't have the numbers on machine translation specifically. Shame on me, I should have those numbers. But I do know that we have a big increase in the use of these other technologies that where language technologies are integrated. So the answer, I think, is yes, it's increased.
Yeah, exactly. We've seen it increase, and for our existing customer base, their employees having to work from home and remotely are increasing their use of the machine translation tools for secure collaboration and communications. Mm-hmm. And we are seeing, other, prospects that were already, discussing with us, having to, advance, those discussions, because they do have a need for their work at home employees to be able to communicate globally. But of course, there's some industries, as we all know, that have been hit very hard. And so, of course, in those industries, the usage is down, in travel and hospitality in those areas, because obviously there's a lot of impact on those industries in general.
Thanks.
Great. Well, with that, we are also at the hour. So JP, Alex, Will, thank you so much for joining us today. It was great to get all the information and insights from the different companies and different regions. Thanks again. And thank you for co-hosting this webinar with me. As we were saying, we will get back with another webinar probably in a couple of weeks. So keep an eye out on our agenda, or you'll get a note in your inbox. For now, I wish you all a great afternoon, evening, or day.
Yes, take care.
Thank you.
And some sleep
Everybody
for
take
Alex.
care. Thank you.
Bye.
Bye-bye. Bye-bye.
Bye-bye.